Hello and a very good evening all. I'm ADITI LAMBA coming to you from our ITV Gold studio located here in Queens, New York City. This is Vision of Asia Coronavirus Pandemic 2020, an ITV Gold exclusive South Asian news series. Hope you're all doing well and staying inside safe and healthy. Millions of Americans are currently on a hold right now while we figure out as a nation to address public health safety as the priority of the hour. Please stay inside and really help the community stop the spread and take precautions. Today, the World Health Organization said that the United States could potentially become the global epicenter of the coronavirus pandemic, which has now also forced organizers to postpone the Tokyo 2020 Summer Olympics. According to reports coming in, the Trump administration plans to use Defense Production Act as of today to procure 60,000 test kits amidst severe shortage of kits, masks, ventilators, and other crucial equipment for healthcare workers. With our affiliation with some of the leading healthcare as well as medical South Asian American associations and several nonprofits, the entire Vision of Asia team would like to thank all hardworking professionals who have been serving the community during this crisis and are the real heroes of the front line. Truly appreciating all the medical and healthcare workers, do look for ways to help out these true heroes who are requesting all to follow these three words: stay, stop, save. Stay home, stop the spread, and save lives. Again, requesting all non-essential workers and professionals who aren't required to report to work from home and stay inside. Containment is what the doctors are recommending right now. Send us your experiences and your comments via email or on video on events@itvgold.com. Perhaps words of encouragement and solidarity during this time. Let's now begin tonight's episode reflecting on more on the ongoings of COVID-19 response, exclusive featuring New Jersey Governor Phil Murphy. Let's take a look at the headlines. New Jersey Governor Phil Murphy addresses South Asians on COVID-19 updates, ITV Gold Skype. Dr. Tushar Patel on coronavirus pandemic, stay, stop, save, ITV Gold Skype, New York City. Ekal Vidyalaya non-profit on the need of the hour, COVID-19 featuring Ranjani, Saigal, ITV Gold studio. This and a lot more on the other side of the break. Stay with Vision of Asia, voice of the community. We'll be right back. Welcome back. I'm ADITI LAMBA and this is Vision of Asia Coronavirus Pandemic 2020 edition. Starting the show, let's take a look at our conversation with New Jersey Governor Phil Murphy, who joined us for a Skype call addressing South Asian Americans and other communities on the national platform. The governor has issued a stay-at-home order for nearly all of New Jersey's 9 million residents to combat the spread of coronavirus, saying that we must flatten the curve and that it is a wartime situation and it needs to be handled tactfully. New Jersey residents now must stay home and all non-essential businesses have to close indefinitely and all gatherings have been cancelled until further notice. This does not include essential businesses such as pharmacies, grocery stores, media, banks, and others. Visit the website of Governor Phil Murphy, www.newjersey.gov, and find all of the COVID-19 related information, resources, and updates. Let's take a look at our conversation with New Jersey Governor Phil Murphy on action and measures during COVID-19 crisis. Joining us via Skype, here is Governor Phil Murphy. And right now we have the honor and privilege of having with us, joining us from New Jersey via Skype, we have with us New Jersey Governor Phil Murphy. He has very graciously agreed to address the South Asian American diaspora across the nation. Lots to talk to him and lots of information coming in from the government of New Jersey. So let's welcome on the show. We are joined right now live by Governor of New Jersey. Thank you so much for being with us, Governor Murphy.
Great to be with you and thank you so much for having me on.
Yes, definitely. I really appreciate you addressing the South Asian American diaspora and also all of the other minority communities that are watching us live across the nation right now on ITV Gold. My first question to you has to be, there is a huge lockdown in New Jersey. You actually tweeted, and I loved it. It said, "I take the personal responsibility for the public health and safety of New Jersey. If you are unhappy about our aggressive social distancing measures, I am sorry, but your safety is my highest priority." I would love for you to sort of reflect on that tweet and how important that was for you to address that.
First of all, again, it's great to be on, and I will just say this: the South Asian community is as important to New Jersey as any other community, and frankly, more important to New Jersey than the South Asian community is to any other American state. So I'm thrilled to be here and speaking with you, and also speaking through you to your viewers. Listen, this is something that we began meeting on in January. I formed a whole of government task force on February 2nd. We've been trying at every step of the way to stay out ahead of this virus and stay out ahead of the COVID-19 disease or healthcare challenge that comes with it. We've taken an enormous toll. We are part, particularly in the northern part of the state. I know your family is in Middlesex County, from sort of Middlesex and Monmouth up. We're part of the New York metro area, and that area is the hardest hit area in America right now. So we've had several thousand people test positive. Tragically, we've lost 44 of our fellow New Jerseyans have lost their lives. We're doing everything we can to both get out ahead of this and flatten that curve through social distancing. And we've been as aggressive as any American state, everything from calling the National Guard up to restricting travel to shutting schools to telling people, frankly, just stay home. So we're doing that on the one hand, and on the other hand, we're expanding as best we can our healthcare system in terms of beds, the heroic healthcare workers, and the equipment that they need to do their jobs. So that's the challenge we're dealing with. We get there, we will get through this, there's no question in my mind, but we'll only get through this if all 9 million of us do our share and do our parts, and I'm confident New Jersey will do just that and emerge stronger than ever before.
Well, as a loyal New Jerseyan, I have to say I have a lot of faith in the government, and I thank you for your time and all of the efforts you're doing. I must ask you, we are addressing flattening the curve, staying inside, really using the social distancing to the maximum capacity. Your question on flattening the curve, how do you address it in the next couple of weeks? Where do you really see the curve flatten in terms of the communities in New Jersey and the time frame you're looking at currently?
Yeah, so I don't have a satisfactory answer for that. I apologize, but no one really does.
Right.
I will say this, the most aggressive action that we have taken, and we've taken a lot of aggressive steps. I'll give you an example. We went from infinity in terms of the amount of people who could gather in one place to 250 to 50 to now 0.
Yes.
So the most aggressive steps we took as of last Saturday, so that's 3 days ago. If you believe the medical facts and science as we do, this virus can take up to 2 weeks to run its course inside of any human.
Right.
So I think we're at least 10 or 12 days away from having even the earliest sense of whether or not the aggressive social distancing is doing its part, it's doing its job. God willing, it will be. And when we see that, and God willing, we will see it, we can then much better project on where we go from there. But this is somewhere between weeks and months, if I had to guess.
Yes.
Not too long after this interview, I've got a modeling meeting with our healthcare experts on exactly where we see this headed. But this is going to be with us for a while.
You know, Governor, while I'm talking to you about what's happening and how long it's going to last, I'm asking you because we are very closely following your story and how open your administration has been about the need of the hours, how proactive the New Jersey government has been in terms of really blocking people up and making sure that preventative measures are taken. We had heard about your conversation with President Trump. I know that you have also asked for the federal government to help. FEMA is a huge part of this whole process as well. Your take on the communication between the federal government and the state government, and also what is the need of the hour for New Jersey as a state right now?
Listen, the relationship that we've had with the White House has been a good one, and I don't wake up every morning picking my president. Our president is Donald Trump. Our vice president is Mike Pence. And I have to say they have been very responsive to us. The FEMA leadership, the Army Corps leadership, first rate. I went to the president yesterday with a number of asks. One was personal protective equipment. Yeah. Shortly after the call, we got another installment. We need a lot more, but it was another installment which we desperately needed. I went to him and asked him for help in setting up and getting FEMA to set up field hospitals. We asked for 4, we got 4. They're en route to New Jersey right now. And so we have a good working relationship. We need more resources. We need federal money, I hope, coming out of the bills that will get through, the big bill that will get through Congress and, God willing, signed by the president. We need that to have direct state aid, direct cash assistance for states. We're laying it all out for our folks who are sick, for workers who are out of jobs, small businesses that are getting crushed. We need the federal government to come in behind us and support us. But the relationship is a good one, and I'll do everything on my side to make sure it remains a good relationship.
From New Jersey, Governor Phil Murphy, let's now take a look at our conversation today with leading South Asian American healthcare professional, Dr. Tushar Patel. This is our weekly follow-up with Dr. Patel, whose expertise in disease prevention and education is helping us provide current updates and information on the coronavirus pandemic. He is also the president for Indian Health Camp of New Jersey, as well as the chairperson for Gopio International. According to the CDC, the center and state and local public health labs are currently testing for COVID-19, which has been reported now in all 50 states, with cases including travelers, community-acquired, and person-to-person. Most of the nation, as we speak, is being placed on a hold, especially with us in New York City with the shelter in place. Dr. Tushar Patel highlights some crucial information on stay, stop, and save and the needs of the hour. He also joined us via Skype from New Jersey today. Here is the conversation. Currently, we are updating and raising awareness about COVID-19, the coronavirus pandemic that has truly hit our nation and many other countries in the world. Joining us again for a follow-up interview, we have with us Dr. Tushar Patel, a leading medical professional who is joining us via Skype from New Jersey. Dr. Patel, thank you so much for being with us here on ITV Gold.
Thank you so much, Aditi, for doing this again, for this wonderful information for our audience.
Yes, definitely. We are the South Asian news segment. We go, live every single night. So it's important for us to bring forth some really important issues. And right now, the entire country is only discussing the COVID-19 crisis and how primarily right now the entire tri-state is shut down. Parts of the country is also on a lockdown, and there's so much concern regarding what is causing this virus and how can we truly stop the spread. So, beginning this interview with you, doctor, I have to ask you, currently these three words, stay, stop, and save, have become a narrative that we keep on seeing everywhere. Stay home, stop the spread, save lives. Question to you, do you agree with this, and your comments and sentiments on what's happened since last week?
Absolutely. I agree with you, Aditi. And the most important thing, this is the second week on slow the spread of coronavirus COVID-19 disease in the country. And tri-state, New York and New Jersey are number one and number two states in the entire nation. So my message to everyone is very loud and clear. Stay home and restrict activities outside your home, except if you are acutely sick and need to go see your doctor or your provider.
Right.
And the essential workers, those fall into category of medical, paramedical professionals, pharmacy owner, law enforcement officers, postal workers. Those people needs to go to work. Everyone else should stay home and follow the state government guidance on keeping the safe distancing and reduce the spread of the current pandemic going on in the country.
Yes. And doctor, just discussing more on this pandemic, I kind of want to start and bring in the perspective of medical equipment. Currently, this entire week, we keep on hearing about lack of medical supplies, how these masks that we were talking about that the audience or normal public wanted to wear, these have become essential units. A lot of doctors are complaining about having to reuse masks. They're saying there are not enough ventilators. They're saying that there are not enough beds in this country. Your questions, concerns, and also comments on this entire issue, since you are a medical professional?
So definitely there is a huge concern about the acute care bed, especially these medical supplies and especially the ventilators. And according to the latest information from FEMA, Federal Emergency Management System, has started delivering medical supplies to hard-hit areas, especially New York, Washington State, California. And I think the construction companies and some other manufacturing companies who does other productions, they have started making the mask, making the ventilators, manufacturing the ventilators. And I think the other companies, medical supply companies, started sharing, donating the supplies to the FEMA and other states. So I think within next few days to next week or so, I think we will see the less scarcity of the medical supplies, especially the ventilators. And I think the federal government and the state government, especially in New York and New Jersey, they are working on making hospitals like Jacob Javits Center will be the new hospital for 1,000 bed.
Which
so
they
I think
already
those
started
are the steps
already. Yeah, the Javits Center has already been started as we speak.
Acutely ill patients.
Yes. Just in terms of the Javits Center, as we were just speaking about, Doctor, and also in terms of these pop-up hospitals, we were reading statements by the governor of New Jersey, who has asked, for federal aid and federal support for these pop-up hospitals. We are seeing the Javits Center in New York City turn into a facility as well. Your comments on the need of the hour for these additional spaces, and how alarming should the audience be when they are hearing about this right now?
I think we need to be prepared for this kind of things. Not only the Jacob Javits Center or the big convention centers, but I think the schools, probably some of the big areas where we don't use it, like a school gym or auditoriums. I think those are the areas probably we may need to consider, and we should not be getting alarmed by this, because I think that's normal part of the response. If we don't have acute care bed, and if we need to take care of the sick patients where we need to put the ventilator or oxygen, I think those are the areas we need to concentrate and ensure that the patients are safe and we don't overcrowd the current hospital system or the staffing.
I believe the concern here is, just last week, a lot of us didn't have to worry about our own parents, getting coronavirus, or our own loved ones in a certain age group. And, over the weekend and this week, with so many massive changes with the increase of cases, one is wondering, how bad is the situation going to get when we are requiring extra beds? We need more ventilators. There are not enough masks. And also, should, now the public, when it gets really, really sick, should they now go to the ER for any symptoms they have? Your comments on that entire situation and how we should honestly understand it.
So most people, which are about 80% of people, who gets COVID-19 infection, who are under 60 years of age without any pre-existing medical conditions such as heart, lung, or kidney disease or diabetes, they will fully recover without any treatments. Just symptomatic treatment, taking acetaminophen or Tylenol or the over-the-counter medications. The key thing is, for those individuals, they need to keep themselves isolated if they have infection. If they have elder parents or elder grandparents home, they need to isolate themselves, ensure they cover their cough and sneezes, and wear the face mask for those sick people, and avoid sharing personal household items. I think those are the steps they need to take if they are sick. No concerns for those healthy individuals. When the elderly, 60, 70, 80 years old parents and grandparents get sick, they need to ensure that they call their primary care provider first. Do not rush into the emergency room. Do not rush into the provider's office, because I think they will definitely violate the policy of state government as well as the hospital and infect more people. So I think we need to ensure that if someone is sick with fever, cough, sore throat, or difficulty in breathing, they need to ensure that they call their provider first, because they drive to their provider's office or the hospital.
Time for the show break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome again. You are watching the Tuesday night edition of Vision of Asia, Coronavirus Pandemic Focus. Today, Indian Prime Minister Narendra Modi said that the government of India is imposing a nationwide lockdown from midnight in India for the next 21 days to stem the spread of coronavirus. It is being called the Janta Curfew. PM Modi said that there will be a total ban on venturing out of homes in India during a national address. India has so far reported over 480 cases and 9 deaths. However, there is a fear of an outbreak of the pandemic there. Prior to the announcement of the countrywide lockdown, we spoke with Ranjani Saigal from Ekal Vidyalaya, one of the leading non-profit organizations empowering underprivileged Indian children and many others across the United States as well. Millions of children are being helped by these non-profits, functioning heavily in India to educate, enable, feed and empower young South Asians, and the COVID-19 crisis had put many of these operations and children in need without resources or very limited access. Ekal Vidyalayas basic bringing education to every child in rural and tribal India, the movement which has been awarded India's government's Gandhi Peace Prize, works very closely with aspects of Indian government to bring opportunities and access for all children in need. Ranjani Saigal joined us from Boston, Massachusetts via Skype to highlight on various updates and methods for South Asian Americans to currently donate and contribute to Ekal Vidyalaya. Let's take a look. Right now, we have the privilege of honor of being joined by Ranjani Saigal. She's joining us all the way from Boston, Massachusetts via Skype, and she is a part of Ekal Vidyalaya, one of our proud media partners, an association that truly believes in giving education to every child of India. So bringing to you through Skype, we have with us Ranjani ji. Let's talk to her about what Ekal is doing and how everything is going. Welcome to the show, Ranjani ji.
Thank you so much. What an honor to be here.
Ranjani ji, I wish I had you at a better time period, but currently we're going through this coronavirus pandemic and so many things have changed, and we're just trying to figure out the impact and the gravity of the situation and perhaps how all of us can help as an Indian American community. So my first question to you is, Ekal Vidyalaya, with how massive its programs are, with the millions of children being helped, what is going on with all those programs right now, and what are your biggest concerns of the hour?
Sure. So one of the things that is interesting about Ekal is that we run our schools in remote rural areas.
Right.
So the one good thing about that is that they don't have that much interaction to, outsiders. Hence, what I'm hearing is that there has been no impact of corona as such in these villages. However, we do have volunteers that go back and forth between the city and the villages. And hence, what we have done is followed the advice of the Prime Minister, and actually we have closed the schools for 3 weeks now in the villages. So they are not running at this time. And we are really very, very clear to all our clearly given instructions to our teachers to be very safe and follow all the rules that have been set forth by our, by the national public health initiatives. The good thing about Ekal is that we actually can reach these villages and ask them to be safe. So we are really hoping that by doing that, at least we are doing some information giving, and hence hopefully there should be no issue in the villages. We will see, God willing.
Ranjani ji, you're saying currently the centers that give education to children, the schools that we're talking about of Ekal, Ekal on Wheels and all those programs, are they currently shut?
Yes. Absolutely. For 2 weeks, we are completely turning it off so that there is no issue. So currently, these villages are not exposed to any of this virus, we think. And
Correct.
We don't want our city level volunteers who go into these villages, because we do have some of that interaction. And we just want to avoid any risk. And of course, following the dictum of our Honorable Prime Minister, we are doing
Right.
that.
Yeah, so as you just suggested, PM Narendra Modi has basically called for all of India to just keep themselves very healthy and keep them inside. We're talking about how the cases are less because this quarantine or self-quarantine started in India a long time ago before it started here. So in terms of when we're looking at Ekal, and the fact that the centers have to be shut right now due to the emergency, due to the health crisis, what is going on in terms of empowerment and development of these children? We keep on hearing schools are shut, everything is shut. You're talking about the most underserved communities here. What is the thought process right now to, sort of get them back on track eventually?
Sure. So couple of things I would say. One of the things is that right now, actually about 2 years ago, we started actually giving tablets into the villages. So many of our schools now do have tablets. So the kids, even though we don't have formal schooling going on, one thing is, of course, these are villages, so people do, social distancing doesn't quite work in the same way that we are talking about in the cities. Schools are not very big. Our schools are very small. It is 20 to 30 kids. And so, but when the teachers are not running these schools, they have these tablets that they're playing with, which is a great boon coming, at this point of time. Unfortunately, we have that as a pilot program and we have it only in 1,000 villages.
Yes.
So there are quite a few villages which don't have it. And so, we were starting actually this year to really push to get tablets into the villages so that just like in America, where people are learning through, e-learning, we can do similar things. We have the idea, the processes in place. So God willing, if we can get the funds to get those tablets into those villages, futuristically, I hope we never are in this situation, but if we are, we should be in a better place, I think. But wherever there are, these computers, the kids are playing with it, and the teachers are also giving them information about the big development is, what is, the information on corona, and, the idea of that itself is education that's going on right now.
And this is all for the show for tonight. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. Remember, you can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from our studio in New York City. This is Vision of Asia and I am Aditi Lamba. Take care and be well, and please stay safe.